Hello, this is Dr. David Greene, CEO of the Texas Pain Network. Today's topic is the basics of disc bulges and disc herniations. Here's a look at the normal intervertebral disc. It's 80% water and 20% proteins and collagens. So there are two areas, and the best analogy is that of a jelly donut. So the outer part of the donut is harder, and it's called the annulus fibrosus, and it does have nerve endings, so it can feel pain. The inner part is the jelly. It's called the nucleus pulposus, and it does not feel any pain because there's no nerve endings. The disc acts as a great shock absorber. Every time we walk, bend, twist, jump, it squeezes out the water to absorb the stress and then pulls it back in. When disc degeneration starts to occur, it usually means that the disc is losing water. And it's usually between the ages of 20s to 50s is when it occurs, and it can be accelerated due to several risk factors, this being obesity, smoking, repetitive trauma like being a long-distance truck driver, genetics, and social factors, a lot of which we don't understand. And this can lead to loss of fluid in the disc, loss of height in the disc, and tiny tears or cracks in the annulus, which is the outer part which has the nerve endings. So you see a healthy disc here, then you see a disc that's losing height because the water's going away, and you see how it's bulging out. It's almost like a tire that's getting flat and it starts to bulge out as a result. So a disc bulge represents a loss of water in the disc, almost like a tire that's losing air. And the result is a loss of height and bulging. So you can see that here you have a significant disc bulge. Interestingly enough, 35% of those between the ages of 20 and 40 have degenerative disc disease and bulging and no back pain at all. That was a very interesting study. Just because you see it doesn't mean it's going to hurt. Okay? Now, a disc herniation is when a tear occurs in the annulus and the inner jelly squeezes out. Okay? So here you see an intact disc, and here you see a disc bulge, but you don't actually have a frank herniation. But here there's actually a tear in this outer part, and some of the inner jelly has squeezed out, and it's pinching on this nerve root. Okay? So there's various names for this. In layman's terms, it's called a slip disc. It can be called a herniated disc, herniated nucleus pulposus, prolapsed intervertebral disc, herniated intervertebral disc. They're all the same thing. All right, symptoms of a disc bulge and herniation. Most disc bulges don't cause any pain, okay? But if it does cause pain, it may include back pain. It may cause sciatica. Even if it doesn't pinch directly on the nerve, it can cause some inflammation that affects the nerve root, and back spasms and aching. Now, disc herniation that is pinching on the nerve and sparking up inflammation, that can cause burning, searing pain down the affected leg, pins and needles, maybe some numbness, motor weakness, which is not all the time, but it can happen, and then rarely incontinence, and that's a surgical emergency when that happens. When it comes to treatment of disc bulges and herniations, one treatment is simply benign neglect. You can actually just ignore it, and if it's not bad enough, it may just go away. Over-the-counter medications such as anti-inflammatories and Tylenol may be extremely beneficial. There's also physical therapy and chiropractic treatment. Spinal decompression therapy is a computerized intermittent traction. Studies have shown that to be over 85% effective for pain from bulges and herniations. When it comes to prescription medications, a Medrol dose pack, probably used every few years, consists of a burst of prednisone and then a 5-day taper. That can be very helpful. Narcotics for short-term use can be very helpful. Non-narcotic medications such as tramadol can be great. Muscle relaxers can help with the spasms and the aching. Neuropathic medications may include Lyrica or Neurontin. We don't actually know how they work, but they work very well for nerve pain. And then topical medications, prescription pain creams or patches. Interventional treatments for disc bulges and herniations may include trigger point injections for spasms and aching. Those are great. Intradiscal injections. This involves basically just steroid injection into the disc. Studies have shown that that can provide up to 3 months of pain relief and then can be repeated. Epidural injections, such as you see here, involve the placement of steroid medication around the affected nerve root that's being pinched. It doesn't fix the problem, but it gives nice, soothing anti-inflammatory medication right at the source of the issue. Over 75% of those with degenerative discs and associated symptoms are able to avoid the need for surgery. Out of those who have sciatica due to either a pinched nerve or irritation from an annular tear, over 95% of individuals are able to avoid the need for surgery with the pain treatments that I mentioned. The outcomes of disc herniations at 1 year are no different than that of discectomy. That was a landmark study back in 2006 that showed that those who had surgery got out of pain faster and got back to work faster. But other than that, the pain relief outcomes, everything was identical at 1 year. And those who didn't have surgery avoided those potential complications. The top non-operative pain management in Texas is through the Texas Pain Network. There are several clinics throughout the state accepting over 50 insurances, including PPOs, self-pay, workers' comp, personal injury liens. Over 25 treatment options are provided, and over 90% success rates on average are achieved by the board-certified award-winning doctors. Visit us online today at texaspainnetwork.net, and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Greene with the Texas Pain Network. Your pain stops here.